and B are 19-year-old identical twins living with their mother and father. Here's some background information. The twins were separated in high school in hope that they develop dependence. In protest, they started skipping school, refusing to complete schoolwork, and waited for hours to walk home together. During the last year of primary school, as their parents gave in and let them go to school together, the twins gradually lost interest in socializing with their friends and peers. B eventually quit school, and A left shortly after, 2 years before hospitalization. A and B both stopped talking to their parents and refrained from speaking in public. A and B spent much of their time going to judo lessons, praying, and communicating with their rabbi. Pre-hospitalization for A and B. The twins were both referred for ambulatory psychiatric treatment at the age of 15. They were first treated for obsessive-compulsive disorder symptoms, taking 40 milligrams of fluoxetine per day. A and B soon refused to take their medicine, so their mother began to put drops of zucleopenthoxyl in their food. When they found out, they accused her of trying to poison them and became angry and aggressive towards her. A's hospitalization. A was involuntarily hospitalized in a secure adolescent inpatient unit immediately after assaulting his parents. A was suffering from delusions of persecutions towards staff in the hospital and his parents. He was also dealing with visual hallucinations. According to A's rabbi, his religious obsession and refusal to speak to his parents because they weren't religious was due to his illness and had nothing to do with his religious beliefs and practices. A showed signs of improvements quicker than B, though, and was able to visit his brother occasionally on the weekends. A's diagnosis and treatment plan. A was diagnosed with paranoid schizophrenia. He responded quickly to the neuroleptic medication he was given. A was first given 5 milligrams per day of haloperidol, and then 150 milligrams per month of haloperidol decanate. Furthermore, A's psychotic symptoms and communication with his parents improved. He was only hospitalized for 5 months, which was much less than his brother's. B's hospitalization. From a result of A being hospitalized, B had a severe breakdown. He refused to eat anything other than canned foods, accusing his mother of still poisoning him with medication. B was taken to the hospital immediately after attacking his mother and taken to a psychiatric emergency room in a separate hospital than A. As well as A, B spoke very little and isolated himself. B's illness was seen to be worse than A's, and he was easily aggravated by his linguistic and learning problems, as he had a low IQ score. Schizophrenia in both A and B was seen to result from the fixation in the symbiotic phase of development with the failure to separate. B's diagnosis and treatment plan. B was diagnosed with more of a disorganized schizophrenia. B was less cooperative than A regarding to his behavior and refusal to take medication. After being informed A was receiving the same medication, in which helped him improve, B agreed to take it. His hospitalization only lasted 14 months, which was much longer than A's. The discharge and follow-up. Both A and B worked in their family's textile factory, but soon quit. They began studying for exams for high school, and successfully passed. They also worked together to receive their black belts in judo. You must have 2 or more of the following, each present for a significant portion of time during a 1-month period, or less if successfully treated, to be diagnosed with schizophrenia. The DSM criteria includes delusions, hallucinations, disorganized speech, catatonic or grossly disorganized behavior, and negative symptoms. The lifetime prevalence of schizophrenia is approximately 0.3% to 0.7%. There are negative symptoms and longer duration of this disorder that show higher incidence rates in males. Risk factors include environmental, genetics, and psychological. In A and B, there were no genetic risk factors included, as they didn't have anyone else in their family struggle with schizophrenia or any other major mental illnesses that their parents included or described. So it was most likely psychological. Diagnostic criteria. A. An uninterpreted period of illness during which there is a major mood episode concurrent with criterization of schizophrenia. Delusions or hallucinations for 2 or more weeks in the absence of a major mood episode during the lifetime duration of the illness. C. Symptoms that meet criteria for a major mood episode are present for the majority of the total duration of the active and residual portions of the illness. D. The disturbance is not attributable to the effects of a substance or any other medical condition. This would include drug or substance abuse. And this is my works cited.